Hello there, welcome. So tonight is the first of two sessions that I'm counting as quite special because tonight we are focusing on other OET professions, those that are not nursing or medicine, which usually gets most of our attention. So we want to let dentists, dietitians, occupational therapists, optometrists, pharmacists, physiotherapists, podiatrists, radiographers, speech pathologists and vets know that we value you too and are keen to help you prepare for OET. So on Tuesday, we ran a session for nursing and yesterday we did a session for doctors. So if you are a nurse or a doctor joining tonight, you're very welcome to stay, but you might want to check out the recordings for those sessions which are now available on our Facebook page, because tonight it's not about nursing or medicine, it's about the 10 other professions that take OET, and we're going to be looking at the sample test for those professions. So I had a look a little bit earlier as to who had registered for tonight's session. It's great to see a number of you registering, covering 9 of the other 10 professions that can take OET. I had to make a decision about how I could split the two sessions. So tonight I'm going to look at the sample test for pharmacists, physiotherapists and dentists in some detail. And then tomorrow I'm going to have a look at the sample answers for the other 6 professions. So apologies if I can't cover your profession today and you're unavailable tomorrow, but we will make sure that the recording reaches you. I just had to find some way of separating, and because we have these 2 sessions available, I decided to go with pharmacy, physio and dentistry first because those were the biggest numbers of candidates registering for tonight's session. So I will be covering all of the professions either today or tomorrow. And a lot of what I will say today is useful for you, whichever your profession is. So if you can stick around for today, I think you'll still pick up something that is useful. So what we're going to do today, as I said, is to share the sample answer for those 3 professions, and I'll talk through what everybody can learn from using a sample answer, regardless if you're one of those 3 professions or not, and how you can use the sample answer for your profession after you've written a letter, as well as how to make sure the letter that you write for the sample test demonstrates the highest level possible for the 6 assessment criteria. So I'm going to ask you a couple of questions as we get started. So one of the things I'd like you to do, perhaps in the chat box, if you have a look at the control panel that comes with GoToWebinar, you should see chat possibly at the bottom of your control panel. And if you click on the arrow to drop down, you can type a message in there, and I'd like to know what your profession is. So if you could tell me what is your profession, type into the chat box. And then the other thing that I'm going to get you to answer is a poll question about whether you have written a letter yet for sample test 4 for your profession. So I'm going to launch the poll question. And hopefully once you've answered that, you can also type your profession into the chat box. I can see a few of you are actually typing your professions into the question box. Maybe chat isn't available to you at the moment. So I can see we've got a pharmacist and a few nurses, physiotherapist, pharmacist, dentist. That's great. So we've got a variety of professions, and so far, pharmacists, physiotherapists and dentists, those are all the ones that I'm going to be covering tonight. So that makes me feel a bit better. As I mentioned, it's fine. It's lovely to see you joining as a nurse or a doctor, but just be aware that tonight I won't be talking about either the nursing or the medicine test, but there's probably still something that you'll learn from the session. So in terms of the poll question, I can see most of you have said, actually, at the moment, I haven't written a letter yet for sample test 4. 40% of you are saying, yes, you have, but 61% are saying not yet. So that's fine. Obviously, after I've gone through the sample answer, you can then have a go to write your own letter after that using the advice that I have given you. All right, so let's close off the poll and get on with the session. So what I'm going to add now, hopefully this is another part of your control panel. I'm going to add for you the handout of the sample answer. I'm just going to click the 3 that I'm covering tonight. I'm adding that to the handout because although I'm going to show them on your screen, it's not working quite right. Let's just try it this way. Bear with me a second. Okay, we're looking for that one. Oh, it's not. Okay, that will open. So there's dentistry loading now. Let's see if I can also load pharmacy and physio. There we go. So sorry, that took a little bit longer than expected. I am going to, as I say, talk about these on the screen, but if you'd like to download your own copy of them now, you can do that from the handout box. So the first thing I'm going to talk to you about is the layout of your letter, and this one that you can see now on the screen, although sorry, it seems to have stopped sharing. We're having some great technical times tonight. Let's try sharing this one, seeing if that one comes up. Great, okay, so right, we're back on the right screen. So the first thing that I want to talk about is the layout of the letter, and this one's for pharmacy, but the advice is the same for all the professions. So what you can see in this letter is that at the top of the page, we've got the address and date, but remember that these can be in either order, so that if you have the date above the address, both of those is absolutely fine and acceptable. So then we have the greeting, which here is Dear Dr. Winslow. But if in your task you don't have the reader's name, then you can just use their job title instead. So for example, Dear Doctor or Dear Pharmacist, and again, that would be equally acceptable. At the end of our letter, we have the ending yours sincerely, and then the job title of the writer, which in this case obviously is a pharmacist. Under the greeting, we've got the RE line, which includes the patient's full name and their date of birth. And in this example, the 2 pieces of information have been split onto 2 lines, which is fine, as also is writing them both on the same line. So don't worry too much about those sorts of little formatting issues. Essentially, a lot of options are accepted by the assessors. Now, one thing I will just point out for any vets joining us is obviously here in the RE line, of course, you would be including the animal's name and possibly their age as well, because obviously vets are writing about animal patients rather than human patients. So the layout is the same for all professions, regardless of this one being a pharmacy task. And then the bits that I haven't pointed out are obviously the body of the letter, the paragraphs, which for this letter has been split into 4. And I wonder if this is the number of paragraphs that you had, pharmacists. If the answer is no, and if for your profession, if you've done another profession other than pharmacy, you've got a different number of paragraphs to the sample answer that you get for your profession, it's not necessarily a problem. And we'll come back to what to do if your letter is different from the sample answer for all professions a bit later in the session. So now let's look at the structure of the letter. And one of the important things to check when you're looking at a sample answer and then with your letter as well, is whether the reader can get a clear picture of the current situation from the way the letter has been organised. So to check this, I'm going to focus on the first phrase in each paragraph, which are coming up highlighted on your screen now. And you can do this for any profession and for your own letters too. So you can see that the 4 phrases at the beginning of each paragraph, we've got Mrs. Paloma is a current patient of yours with breast cancer. Mrs. Paloma takes ondansetron. On the 27th of July, you prescribed oxazepam, and I advised Mrs. Paloma of the potential risk of a drug interaction. So these phrases tell me that after introducing the reason for writing, the writer has focused on the relevant history to this situation, the new medications, which are actually the main reason for writing, and finally the next steps that need to be taken. So while the whole paragraph needs to be clear, making the topic of each paragraph clear from the opening phrase is a good way to score well in organisation and layout, which is one of the assessment criteria, because you can see that the key details are at the front of the paragraph and are not getting hidden by less important information. So when you get the official sample for your profession, have a look at the phrases which start each paragraph and check the clarity of the organisation, which you can get just from those initial phrases. So now let's look at the contents of each paragraph in turn and what contents the writer has included. So we can see in paragraph 1 that the patient's medical situation and the recommendation for review of the medication is mentioned. In paragraph 2, the patient's regular medication and the recent interaction that they had with you, the writer, which is the pharmacist in this situation. In paragraph 3, the medication that was prescribed by the reader, the oncologist, and the regular GP are covered. And finally, in paragraph 4, advice that you gave as the pharmacist to the patient and a request to the oncologist are covered. So now we've got a good sense of what has been included in the sample answer. We can compare these details to the case notes. And the first thing that you should do when looking at a set of case notes, again, for any profession, is to check the writing task. What are we being asked to do? So we can see for this pharmacy situation, we are being asked to write a letter to Mrs. Paloma's oncologist and suggesting a review of the client's medication regime. The second piece of information you should check is under the notes section at the top of the case notes. This tells you what your role is in the patient's care. And so we can see from this section that you are a pharmacist and Mrs. Paloma is undergoing chemotherapy and radiotherapy for breast cancer. So that gives us the background to this situation and our role in her care. And the final thing that you should check as standard when you're starting to look at a set of case notes is the information provided just above the writing task, because this often provides more detail about the reason for writing and possibly some action points that you will need to include in your letter. So we can see that that is true here in this set of case notes, that you are writing a letter to the oncologist, but particularly about Cenipax, which is not working effectively, and the risk of the interaction with Unison, which has been recently prescribed. So having checked those 3 important parts of the case notes, we now want to check that our letter includes all of the details that the reader needs. And we can, from the previous slide, we can tell that paragraph 1 and paragraph 4 was covering all of those details. And that means that the purpose will be clear and should score well for this letter. So looking now at the sample answer for physiotherapy, let's check for similar things. So here again, you can see the opening phrase has highlighted for each paragraph, and this tells us the structure the writer has chosen. So again, they've started with the reason for writing, which is important for any letter that you write. Then they've moved on to the background of the situation, the exam results and current treatment that have been provided, and finally the next steps for this patient. And if we look at it in more detail, paragraph 1 is including the patient's age, occupation and suspected diagnosis. Paragraph 2 is covering the initial consultation, the patient's symptoms and treatment which were prescribed by the patient's doctor. Paragraph 3 includes your exam findings and physio treatment that you've been working with the patient to date. And finally, paragraph 4 makes a specific request to the reader. So in the same way that we did with pharmacy, you're looking at your letter to check, is the organisation that the writer has used clear? Is there sort of one topic that has been provided for each paragraph? And that, as has been seen in the pharmacy letter and now the physio letter, will enable the reader to clearly understand the situation and to read the letter quickly and effectively to understand everything that they need to know. So the next thing to do when you've done this for your letter, for your profession, is to check whether all of these details that we've picked out included in the letter are the ones from the case notes that needed to be included. So having a look at the case notes for the physiotherapy task, you can see that I've highlighted all of the information that has been included in the sample letter. And there's lots of information actually that hasn't been included. So the first thing I'm going to do is look at what has been included, and then I'll look at what hasn't been included. And this is a good way of double checking whether by the end of that process in your letter, you've included everything that the reader will need to continue care and to understand the situation. So we can see from the highlighted information that the relevant background for this reader about this situation has been included in paragraph 2. And then we can see that details from the first physio consultation have been selected to enable the reader to understand the history of the case, and those are covered in paragraph 2 and 3. And on the right-hand side of the case notes, we can see that the recommendations from the physiotherapist have been included in paragraph 3 so that the reader will understand how the case has progressed until now. And we can see that the final highlighted section is actually our reason for writing. That's the bit that I mentioned you should check when you first look at the case notes, the third piece of information you should find. This gives us more detail about why we are transferring the patient to the care of this other physiotherapist. In this case, it's because the patient is taking a vacation. But it's also important to check what hasn't been included in the letter is the right information to omit. So now let's look at the information that is still unhighlighted, that has been left blank on this slide. So we can see that from the top left, details about the patient's initial consultation with their doctor have been omitted because prior to the first physiotherapy appointment, these specific details are no longer important or particularly relevant. A summary that the patient visited their doctor has been mentioned, but we don't need all of the details to be provided for the reader. Further down, still on the left-hand side, we can see that because the patient has made improvements in the 2 days since they've started physiotherapy, all of the exam findings and initial review that you completed as the physiotherapist in the first visit are no longer necessary to include. And over on the right side, we know that we are providing the reader here just the information that they need to be able to review the patient in 2 weeks as per your recommendation, while the patient is on holiday for a fortnight. It's likely, therefore, that the appointment after this 2 weeks one will be back at your clinic. And so again, you don't need to provide exhaustive detail about all of your treatment and recommendations. You just need to provide the reader with the details they need for this one visit that the patient will make for them. So this is something that you can do for all professions. It's having a look at the information that's been included in your letter or in the sample letter for your profession and check that everything that the reader would need has been included. But then also look at the information that's been omitted and make sure that there is a reason for that to be left out. And as long as those two things balance, then you can feel comfortable that you will have selected the information correctly for content, the assessment criteria, and omitted the correct information so that you can score well on conciseness and clarity. So let's now look at the language and vocabulary the writer has used. So still with the physiotherapy letter at the moment, we can see that this letter uses a mixture of sentence types. And here is an example of 3 of them. So there is an example of a complex sentence, a compound sentence, and a simple sentence. And this is to be expected. When we naturally communicate in English, we are going to need to use a variety of these sentence types. And this isn't to say that you need to use one sentence type more than the other sentence type, just that you need to make sure that you're communicating the information as clearly as possible to the reader. And to do that, you will need to combine some details from the case notes. And so using a mixture of sentence types will allow you to do that effectively. Looking at the pharmacy letter again now, we can also see, as would be expected for any letter, a mixture of tenses have been used, including the present simple, the present continuous, past simple, and present perfect. And as well as the different variety of tenses that have been used, passive forms have also been used, as well as an active sentence at the end of the letter to make the specific request from the reader. You can also use that connectors have been used minimally, but when appropriate, like in this example where instead has been used to provide a contrast between the 2 parts of the sentence. Obviously, simple connectors like and can be used more frequently. But the advice that we're giving to candidates is when it comes to connectors, make sure that the connector that you're including adds something to the reader's information. Don't simply add a connecting phrase to start a sentence or within a sentence just to add a few extra words or because you think connectors will help you to score higher in OET. The main aim of your letter and to score well in OET is clarity and communication of the information. And so connectors should be used to help the reader understand the situation, but not to add extra words that they just need to read and skip over to get to the important details that they're looking for. One other thing that I'd point out about this letter, which it has done well, is to avoid sounding accusatory, either of the 2 healthcare professionals, the oncologist and the regular doctor that have been involved, but also of the patient themselves. There's been a bit of a mix-up here that the patient is now prescribed 2 types of medication that would contradict each other, which the pharmacist is picking up and reporting back to the oncologist. But what this letter does well is to remain neutral by just being factual, reporting what has happened without using any kind of emotive adjective to sound like they're blaming anybody in the situation. So that's a good use of language in this letter. The letter also makes good use of brackets, separating the brand name from the generic name, which allows clarity to the reader in having that information separated from each other. So when we think about how the sample letter for your profession has evidenced the criteria, it's good to have a copy of the descriptors in front of you. And you can see from this slide that at the top of the page, I provided a link to where you can find and download these descriptors to have your own copy. And I'd really recommend having this saved as a favorite or print it off and put it on the wall where you study, but having this readily available to you, because these assessment descriptors are so useful in understanding what the assessors are looking for when they're grading your writing, and for you to use when you do a piece of writing to critically analyze what score you would get for the writing that you have completed, because by knowing what the assessors are looking for, you can then try to evidence it in your writing, as well as check how well you did on that after you have written a letter. So definitely download or save this link somewhere so that you can readily access the assessment descriptors. We recommend that you aim for the highest level available rather than settling for the minimum you might need to get the score that you want, which isn't to say that even to get an A grade, you have to have absolutely perfect language and everything has to be absolutely perfectly correct. Even with an A grade, it is possible to get some mistakes, maybe to leave out a minor detail from content and so forth. But if you aim at the highest and you fall slightly short, then you still can feel confident that you're going to get the grade that you want when it comes to your assessment. So let's look at each of those assessment criteria in turn. And this time, again, I'm back to looking at the physiotherapy sample answer. So purpose is looking for whether it's immediately apparent why you have written this letter and whether it is sufficiently expanded. And we can see from the highlighted section that the first paragraph includes a clear reason for writing, and that this is returned to and expanded on in the final paragraph. So this ticks the boxes for purpose. Content is the next assessment criteria, and this is assessing whether you have included all the information needed by the reader to continue care and whether it accurately represents the history provided in the case notes. So we can see in this highlighted section that details of the patient's improvement and ongoing treatment have been recorded accurately from the case notes. In conciseness and clarity, this is checking whether you have summarized the information effectively and presented it clearly to the reader. So we can see that the initial examination has been summarized effectively into a couple of sentences. Remember, from those case notes, there was a lot of information about the initial visit to you as the physiotherapist. And this has been summarized effectively just into a couple of sentences, which means the reader can avoid wading through a lot of unnecessary information. Genre and style is the next assessment criteria, and this is checking whether the writing you have used is clinical and factual and is appropriate language for this kind of document as a formal letter. So we can see from this section, which is highlighted in red, that the letter includes appropriate technical language for this reader, and that they have used brackets minimally but effectively to avoid reducing the formality. Organisation and layout is the next assessment criteria, which we covered towards the start of the session. It's checking whether your letter is logical, clear, and the key information is highlighted. So this letter includes some useful time words to help the reader understand the timeline of events. So for example, we've got on the 28th of August 19, 2 days later, in 2 weeks' time, on initial examination, and so forth. And as previously discussed, there is a clear theme to each of the paragraphs, making the letter easy to follow and understand. And the final assessment criteria is language. As would be expected from the sample answer, the language features from this one provided by OET are completely accurate. Additionally, as we've seen, language has been used flexibly through different types of sentence and tense use to clearly communicate the information to the reader. So, having only looked so far at pharmacy and physio, I'm going to come on to dentistry in a moment. Just asking those pharmacists and physios that are watching this session, how accurate or how close do you feel your letter is to the official sample that I've just been sharing now? Dentists, you can also join in the poll if you've had a look at the official sample that I've shared as one of the handouts. Okay, so that's good. The majority of you, 60%, over 60% of you are saying my letter is quite similar, but then some of you are saying either almost the same or quite different, and that's as would be expected. So I'm now going to give a few tips and strategies about what to do if your letter isn't quite the same as the official sample one. So what can you do after completing your letter? So it's important to remember that sample answers are only one way to write a letter for these sets of case notes. So those of you that answered your letter was quite similar or even quite different could still well have written a good letter, provided you have evidenced all the assessment criteria equally well to the sample letter. So you're trying to check that your letter evidences the assessment criteria as well as the sample answer. Obviously, it could address it not so well if you're aiming for a B grade, because as I mentioned, when looking at the assessment descriptors, you don't need to score that top band. That's just the level that we're aiming you to reach for. To hopefully have the confidence that you'll get the grade that you want on test day. The thing to bear in mind though is if you have missed out information or included information that isn't in the official sample, then this could lose you marks for content or for conciseness and clarity. And similarly, if the accuracy of your language and sentence construction isn't so good, then you will lose score for language. So these are things that you can work on and things to be aware of. We don't want you to think that the sample answers that we share from OET are designed just to be perfect. They're actually designed to be a good model. It is possible to improve them or to use alternate language to say the same thing in the letter. So don't feel that this is just one option and you have to match it. There is more than one way that you can write a letter. Thank you to everybody who submitted a letter in advance. I'm going to go through a little bit later on the letters submitted by physios, pharmacists and dentists. Those of you who are one of the other 6 professions, you're welcome overnight or in the next 24 hours to submit a letter for your profession, and I may have a chance to talk about your letter tomorrow in tomorrow's session. But for those of you who I don't talk about, or perhaps you haven't written your letter yet and you would like to get some feedback on it, we can recommend one of our premium providers, OET Online, who are endorsed for many of these professions and have materials and resources available for all 12 OET professions available. And you can find them listed on the link that I've put up on the screen now. So we would recommend you getting some feedback to your writing, even if it's not from OET Online, but one of our other premium providers, because as well as the feedback that they can give you, they can also give you support and strategies about what you need to do to improve your writing. And the other thing that I would recommend is after this session, once you've written your letter, make sure you review your letter against the sample answer. Look at whether anything that is in the sample answer is more clearly written than in your letter, and potentially make amendments to your writing if that's the case. So spend some time making corrections and then rewrite the letter in perfect English, so when you come back to review and revise from it, you now have your own good example. I'm going to move on for the next few minutes to talk about dentistry. So here is the sample answer for dentistry, which has also been added as a handout. And I'm just going to go through some of those similar things that I've done with physiotherapy and pharmacy so far. So we're going to have a look at the language that has been included. So the start of the sentences and how this explains to the reader what the content is and how the writer has structured the information. So again, the reason for writing comes first. And then in the second paragraph, the relevant history to this situation has been covered, followed by the dental plan, what the dentist believes should happen, then the next steps, and finally a specific request to the reader for their involvement in this patient's care. And if we look at the paragraphs in a bit more detail, we can see that paragraph 1 includes the request to the reader and why this is necessary. Then in paragraph 2, we can see details of the patient's first visit, including their oral hygiene status and test results. Paragraph 3, it's a very short paragraph, just a single sentence. It's obviously the dental plan, and this has been confirmed and discussed with the patient. So that's the only other detail in paragraph 3. Paragraph 4 covers the medical and social risk factors to performing this treatment and the action plan that is necessary as a result. And finally, again, paragraph 5 is a single sentence and is literally the specific request to the reader to enable the treatment to go ahead. So if we look at the case notes, and again, I've highlighted them to show what information has been included in the sample answer. This is something that you might want to look at in a bit more detail, dentists, after this session. But I'm also just going to pick out the information that isn't highlighted so that we can check that this is accurate, that this is the right information to have been omitted. So we can see in the top left the details about the patient's diabetic medication, how much they smoke, and their previous dental visits can be omitted because this is irrelevant to the current situation, focusing on the extraction of a tooth. For a similar reason, details from the recent visit on the 9th of August, which aren't relating to tooth 36 and the reason for extraction, can be omitted. We can see that with the date for the 9th of August, the dentist completed a comprehensive initial exam, and there's a lot of detail provided there, but because the focus becomes quite quickly on tooth 36, the other details can be omitted. And from the right-hand side, a number of treatment options are mentioned, and these are repeated a little bit lower down once the patient confirms the treatment option that they want to proceed with. So these can be summarized. We don't need to mention them more than once. We don't need to sort of show the process of coming to the decision with the patient. It's there to understand the situation as you are writing the letter, but you can summarize that information more effectively by only discussing the treatment option that the patient decided to go ahead with. So I'm going to talk about a few letters that have been submitted. We've got one pharmacy letter that was submitted by Rima. So the good news about your letter, Rima, is that each paragraph starts with a clear topic phrase, and much of the relevant information has been included that the reader would need to be able to care for this patient. But I would say that the reason for writing is not very clear or accurate. So your sentence saying, I'm writing to suggest a review because she's undergoing chemotherapy isn't quite right, and that's misleading for the reader. Also, paragraphs 2 and 3 could be summarized better to avoid some of the repetition of that medication. So we kind of have what's happened with the two medications and why that has happened with the two medications in separate paragraphs, and that could be summarized more effectively into one paragraph. Moving on to look at some physiotherapy letters. So this first one comes from Jessie. So the purpose of the writing here is mostly clear, although a comma after back pain would have been helpful for clarity of understanding. At the moment, without the comma, it suggests that the nurse experienced or sustained the back pain at your clinic, which isn't exactly what you meant. So the comma would actually increase the clarity there. A lot of detail has been provided in this letter that the reader wouldn't need to continue care in the short term. So remember that this reader is only going to be looking after the patient short term. And there are some inaccuracies. So for example, towards the end of the letter, who's going to do the review in 2 weeks' time? It's actually going to be the reader of the letter rather than the writer. And omission about how the injury was sustained in the first place. Both of these things sort of reduce the overall clarity of the writing here. Another physiotherapy letter, this one from Yo-Yo. So this letter has a clear purpose and it's structured well with good use of topic phrases. So that's really good. Some of the detail in paragraph 2 could have been omitted. It's not all really necessary for the reader to understand the situation. And this would allow the patient's medication and the type of injury sustained as an L4-5 disc injury to be included, which would be more important to the reader than all of that detail, which is currently included in paragraph 2. The next physiotherapy letter is from Sophie. This letter also has a clear purpose and structure with the reason for writing clearly expanded in the letter, and there's really good sentence control, even for some long sentences such as those in paragraph 2. Addition of the medication would be helpful. That's probably the only thing that's missing, and overall this is a well-written letter. Elena, there is a bit of confusion at the start about the reason for writing. So for some reason you've said that they have a different condition to the one that's actually being referred to. But other than that, the letter is then structured well for the reader. Some of the details, again, could be omitted while still keeping the reader informed with all of the information they will need. And instead of that sort of additional information in the second paragraph, then the details of the tramadol, for example, could be included. A few improvements to language would also increase the clarity. So, for example, she started with a sharp pain in paragraph 2 isn't very clear, and there could be some improvement there. And then we've got one dentistry letter. This one comes from Sarvin. So this letter has a clear purpose and the good use of dates are provided, but the structure of the letter is then well suited to the reader. All right, so that brings me to the end of the content that I wanted to discuss. It's time now. I've got 15 minutes left from the session for you to ask some questions if you have them. So in the question box that many of you found a little bit earlier in the session, when I asked you what your profession was, you can now write a question to me if you have one, either about your sample answer, your letter, or for your profession. It would be helpful if you include with your question what your profession is, because then I can sort of relate my information to your profession specifically. So let's have a look. There's some questions coming in. So Marianne says, I'm a speech pathologist and I want to know if I can submit a letter if it's possible before the session tomorrow. So yes, so there are 6 professions that I still haven't covered yet. Occupational therapy, optometry, podiatry, speech pathology, radiography, and veterinary science. So if you're one of those 6 professions and you would like to submit a letter before this time tomorrow, you're welcome to do that. Obviously, if I receive hundreds in the next 24 hours, I'm not going to be able to comment on all of them, but please do submit a letter and I'll try and cover several of them in tomorrow's session. So absolutely, Marianne, you can do that. Mariam is asking about the original case notes for pharmacy. So this was provided on my first slide, but I think I can comment. Do go to the website, which is occupationalenglish.org. I'm just going to comment that now. So if you click on that link, you can then find the prepare page and sample test, and that's where you'll find sample test 4. So I wasn't able to upload the case notes as well as the handouts for tonight's session, but if you haven't yet seen the case notes for your profession, do go to our website to the sample test and you'll find them there. Oh, sorry, I think I put that in the wrong place. I put that in the response to the next question, which is from Sophie. So sorry about that. That didn't quite work as I was expecting. But hopefully you're familiar with the website and where you'll find those letters. So Sophie says, regarding the physio letters sample, I'm surprised that the age of the patient is repeated in the first paragraph. I would have thought it wasn't essential information. Sophie, you're right. Things like the patient's age and their occupation are often included as standard in healthcare letters as a way of humanising the patient to the reader, but they're not essential to include unless perhaps it's important in this case that the nurse sustained the injury at work and that's why her occupation is mentioned. But in other cases, the occupation may not be relevant. And because you provided the date of birth, adding the age as well isn't perhaps necessary, but it's perhaps personal choice. You're welcome to include it, but you wouldn't be penalised if you hadn't mentioned their age. Dentist question, can I write the number of 236 or I have to specify mandibular left molar? So I think that's an interesting question and it could depend on the person who's going to be reading your letter. So obviously in this case we're writing to the patient's doctor and they might find it easier to know the number of the tooth rather than the sort of technical dentistry terms for the tooth in the mouth position. So consider your reader and which form they would be more familiar with, and then you can choose between using the number or perhaps using the number and the words initially and then the number on its own after that. Then a question from Indre, who's a pharmacist. What is the best way to start the letter? For instance, I'm writing to refer, or are there better manners? So Indre, I'm writing to refer is absolutely okay, but in this sample letter, you're not really referring the patient because the reader already knows this patient. So instead, you're using language to request a review of the medication review, or you're writing in regard to the patient that the reader already knows. So it does depend on the situation. what kind of language would be appropriate to start the letter, and that's true for any profession. May, who is a dentist, says at the top of the letter, should I include the job title of whom I'm sending the letter on top of the address? So this, again, it depends a little bit on whether you've been given the name of the person that you're writing to or simply their job title. If you're only given their job title, then absolutely that should be written at the top of your letter. If you're given the job title and their name, then you could include both, definitely. But otherwise, if it's just their name, you don't need to add their job title as well as their name if the name is all that's provided in the writing task. Marianne says, will there be another webinar link sent out, or will we be able to join the webinar on today's link? That's a good question. I believe you will be able to join the webinar from today's link as well, because we've listed it as occurring twice. But I will check with the team tomorrow, and if it's a different link, I'll make sure it's posted at least an hour before the session starts so that you can join tomorrow's session as well. Another question from May, can I write the dates in numbers? So for example, 0804-2001. Absolutely, the different formats of the dates are all accepted by the assessors, but we do recommend you to be consistent. So use the same format of the date within the body of the letter. Don't switch between full form and short form or slashes and full stops. Keep it consistent so that then it's clear for the reader to read. A question about whether you can get copies of this information afterwards. So yes, we will be making this recording available online, but also, as I've mentioned, the sample test 4 is now available from our website, so you can go and access that for yourself. We plan to add all of the sample answers to go with the sample tests by the beginning of next week at the latest. Hafsa says, is dietetics going to be covered tomorrow? Yes, so sorry Hafsa, I haven't managed to cover all the professions tonight, but I am planning to cover dietetics, occupational therapy, optometry, podiatry, speech pathology, radiography, and vets tomorrow. So do join me then if you haven't, if I haven't covered your profession tonight. Let's have a look for some other questions. So Jeka, you're the same, so radiography, yes, it will be at the same time tomorrow. So you can access it either by the same link as tonight, or if it's a different one, I'll make sure that it's posted about an hour in advance of the session so you can join it then. Okay, so another Sophie has mentioned, you commented on my letter, but you mentioned that it's missing the medication. I thought because as we're a physio, we're not trained especially about medication, and therefore it was non-essential. I think it's useful for the reader to understand that analgesics are part of this patient's treatment, and obviously that stronger analgesics needed to be prescribed because the original paracetamol weren't relieving the symptoms enough. So I don't think you need to say a lot, just perhaps mention that analgesics and the name of the analgesics are part of this patient's treatment. It wouldn't be enough to perhaps lower your score from a B. The rest of your letter was very well written. So I think that was just a minor omission that would have made it slightly better than it already was. Hafsa, who's a dietitian, if it was a referral letter to the GP, we don't need to write any history of the GP's visit or the lab test numbers. So Hafsa, I will come back to talking about the dietitian task tomorrow, but certainly when you're writing to a reader who knows the patient, this will have some impact on the information that you include and the information you omit, because obviously any information that the reader would already know about the patient, you can either just remind them of it very briefly as context, or omit it completely. So we'll look at that one in a bit more detail tomorrow. And Indra is asking a pharmacy question. Is it important to mention all the medication the patient is on, or just to specify the most important ones? So Indra, I'm not sure if you're asking about tonight's task or not. Obviously in tonight's task, the medication was fairly critical to the situation and the reason for writing to the oncologist in the first place. So it was important to include all of that detail. Potentially, if the patient was also taking other medication, which weren't associated with their chemotherapy or their anxiety and sleeplessness, those details wouldn't perhaps need to be mentioned as well to the doctor. But it does depend really on the situation. And with tonight's example for pharmacy, the details were necessary to include. And last question from Savin, in the dentistry sample, as we are writing to a GP, could we omit the patient medication? Let me just have a quick look back, Savin, at that task. Apologies, haven't got it straight in my mind. So yes, sorry, in this sample, you're writing to the patient's GP. They are familiar, presumably, with the patient's medication, although it does mention in the case notes that they haven't been to the doctor for over 6 months. So it might be worth reminding them, at least, you know, that they have the diabetes, even if you don't specify what exact medication they're taking. All right, that seems to be the end of the questions coming through. So thank you so much for joining me. Just a quick reminder for the doctors and nurses that joined tonight's session, you're very welcome. But your sample task and your session recordings are now available on our Facebook page, so you can go and view those. For those of you who attended tonight, we'll find a way to share the recording with you. And then we will also have the other session tomorrow night, which will do similar things, looking at the letter for the other professions that I haven't covered so far tonight, and looking at some of the letters submitted from those professions. So thank you very much for joining me, and I will see you all again sometime soon, hopefully. Bye for now.